As a digital health entrepreneur, I'm looking at ways on how we can use innovation to help with access and care and better quality, but it has to move faster. Here's why. Healthcare is stagnant. Yes, we have new opportunities out there on how we can improve access and help with healthcare costs. That's not enough. We need healthcare innovation now more than ever. And one of the things is because Medicare costs are just getting out of control. Right now, Medicare costs are around $4.8 trillion. In 2050, we're looking at to explode to over $8 trillion in the next 10, 15 years. This is something that we have to control. And we're going to see more of this. So costs need to be contained. And the best way to contain costs, if you start to look at automation, and automation is around using innovative technologies to kind of help with that process. You know, there's a couple of things to kind of think about this. What areas of innovation can you impact healthcare the most? Well, one of the big things is in the rising cost of chronic conditions. Chronic conditions are exploding. We already know that the baby boomer generation, those 65 and above, is increasing significantly. We've seen numbers where we're looking to over 80 million individuals who will be 65 and above in the next several years, as opposed to something less than 50 million. So this is something that we have to kind of look at and figure out. The bigger population that drives these costs are the populations that tend to be a little bit older. I think about the movie business, right? It's been around for 100 years. And thinking about like all the things that went into kind of making it sustain for a long time. It had to evolve, it had to change. It had to come up with new innovations. First, there were movies that were silent movies where you couldn't even hear the individuals, you read what's on the screen. Then you had to get into movies that had sound and action. Finally, you had storytelling that was big and ambitious with musicals. And then they evolved into more personal, gritty stories in the 70s to the blockbusters in the 80s like Star Wars and other movies. And then finally, you have the superhero movies that evolved here in the 2000s, late 2000s. A 100-year institution had to evolve. Likewise, healthcare has to evolve as they're seeing new problems develop. And one of these areas that they need to really look at is how do we manage the chronic conditions of an aging population? Here's some thoughts around that. Number one, you definitely want to take advantage of technology. There are talks that artificial intelligence can really upend how we treat care. You're looking at three key areas. You're looking at areas around clinical decision-making. How can you enable better decisions from the doctor standpoint to help the patients? You're looking at automating documentation. As we all know, due to the digitalization of health records, the ability to automate that process needs to accelerate. Doctors are spending way too much time in their EMRs trying to document this. So being able to digitize this is going to be key for the future, and AI can help accelerate that. Finally, you can use artificial intelligence to personalize how you communicate to patients to make it more relevant. It's difficult to speak to thousands of patients and telling a story that's unique and relevant to each one of them, right? But with technology, especially artificial intelligence, you are able to do so. Those three areas when it comes to personalization, automating documentation, finally to ensure you make clinical decision-making better, that can help with managing these multiple chronic conditions for millions of patients that we're going to see over the next couple of years. But unfortunately, healthcare is slowing down because of the other issues that we have to deal with. Healthcare is about security. This is health records. They have to be secure. And one of the biggest challenges has always been in how do we secure that information succinctly. That's why healthcare was so long, so resistant to a lot of the digitalization efforts because everything was on pen and paper for decades. So now we're in a situation where a lot of this has now been digitalized. Now, how do you protect that when you transmit it over the internet? So laws like HIPAA, protecting PHI, personal health information, to ensure that patients' data and records are protected is going to be key for the future. How do we keep innovation going faster as long as we have security in place to protect that? The other thing as well as slowing down is just the bureaucracy. Healthcare is complicated. The challenge is, I believe, is that the incentives are not aligned, right? The individuals who do the work are not ultimately paid paid directly from doing that work. It has to be a middleman, which in most cases is a government or other entities that pay for the care based on what someone else does. Because there's this three-level system, it's hard for the doctors and the clinicians who actually do the work in order to understand, exactly the quality and the care that they go into doing the work. It doesn't quite translate to how much they're getting paid. And that can be an issue. Economics 101, you need to understand incentives alignments, right? If folks are doing work, they have to make sure that the work that they're doing, ensure that they get the best benefit for the work that they're doing. So we definitely see a misalignment when it comes to healthcare, and that can slow down innovation. One of the things that we're seeing can kind of break through is having individuals who are champions, right? Who can understand the importance of innovation to break through. If we try to go traditional route of trying to maneuver innovation in so we can meet the standards for HIPAA, which is important, and security standards, and making sure we have incentives aligned, we're not going to be able to lower the cost of care. We're not going to be able to provide more access, and we're not going to have that quality of care, the triple threat that comes with healthcare. That has to be implemented at large in order to get to this next level. And we have to do it fast because, as you can see, as we discussed, you're going to have a lot of issues with patients dealing with multiple chronic conditions that's just going to keep putting more and more tax on our health system. As a matter of fact, they're saying right now, healthcare is about 20% of our gross domestic product, or GDP. That will balloon because the costs are just getting out of control. The sad part is this is something we've seen over the years. And because the baby boomer generation is getting older, these are the individuals born in the 1940s, 1950s. They're in the 65 and above. This is the post-war babies that were born after the war. Balloon the population. Wherever they go, when you look at the trends, that's what happens to the United States. It tends to follow their trends, right? When they were of college age, you saw a lot of people going to college, right? When they were looking for cars, you saw the car market explode. When they were looking for housing in the 80s, you saw tons of housing being available and looking at mortgage rates, right? And now this population is now in the retirement age, and those are the sickest generations. So we're going to have a huge drag on the economy unless we use innovation to solve some of these problems. One of the things that we're seeing and how we can kind of speed up technology is having those individuals, like I mentioned before, that are champions that can spearhead this because they see the problems coming. These are individuals who understand that the need to push innovation forward will help with those costs, help with access, and help with ensuring that the quality of care is there. And that can absolutely happen with the right individuals. There are innovative organizations like the Mayo Clinic, like Moffitt Cancer Center, and other organizations that are really looking at innovation on how they can speed the delivery of that triple care, that triple threat that we're trying to get across when it comes to healthcare. So one of the things that I've seen that's really been beneficial working as a digital health company and how to implement these new solutions, we try to take advantage of the innovation that's already there. And there's pockets there, right? CMS every year comes out with what they call innovation arms. There's CMMI. These are innovations around Centers of Medicare and Medicaid services. They create this innovation list of different targets they want to go after, and they allow organizations to bid for dollars, grant dollars, in order to implement these innovations at scale. And we've definitely seen some benefits from that. Also, this innovation is something that CMS is putting a lot of effort into creating new models around CPT codes to ensure that doctors and physicians and other clinicians are able to utilize innovative ways to reach out to patients at scale to ensure that they do more with that. So in my mind, in my opinion, we have to look at how we can drive innovation faster in order to get to where we need to get to drive out the cost that's going to really be a drag on our economy over the next 10 to 15 years. So this is some of the things that I talk about in future and other videos. So go check them out in the show notes below if you want to learn more about how this innovation can impact you and your organization when it comes to healthcare for the future. If you like this content, go ahead and subscribe, like, and follow me for more information as we kind of do a deep dive on how we can drive innovation and help with the triple threat with healthcare.